Okay. Oh God. Ah! What is that?
How do we get a pet from this to this? With Fear Free, baby! Our patient Zadi was super anxious whenever it came to touching her backside, which we needed to do in order to give Zadi her rabies vaccine. So we are here with Fear Free Certified Veterinarian from that video, Dr. Cortright.
Hi.
So, Dr. Cortright, is this you?
No, that's not me.
Oh, okay. How about this? Is this you?
No, that's still Dr. Coffey. You know who we are, right?
Oh, well, whatever. How did this picture hit me? That's a great question. Is that you in the picture?
It is me.
Can you explain the circumstances surrounding that photo?
Yes, so I had a puppy come in who did really good for her exam but got really nervous when she got brought in the back for her vaccine. So the technicians brought her into a quiet room where there weren't other dogs and people and less commotion. And then she got pets all over, so she got used to being touched in the hip where her vaccine was going to go because that was making her super nervous. And then she got a bunch of head scratches and neck scratches to make sure she didn't whip around and bite the technicians, and she thought she was getting pet the whole time, and she secretly got a vaccine.
Great job, thank you. So Dr. Cortright, Fear Free Certified Veterinarian.
Yes.
What made you decide to be a Fear Free Certified Veterinarian?
So Fear Free is something that I am incredibly passionate about because when I was actually in clinics, I saw the benefits of it for so many patients. But then I actually got my own dog who, although he loves coming here, as soon as he's in the treatment area, he is incredibly reactive, afraid of everything. So I actually use a lot of the fear-free techniques on him specifically when he's coming in for treatment. And it's really something that can be applied to all patients and all kind of levels of fear that they have in the hospital.
What are the changes that you notice in a pet when implementing fear-free practices?
Something that I notice in pets when they come in and we're using the fear-free protocol is, one, obviously our main goal is for them to be less fearful, but in doing that, they're having a more positive experience. It's a better physical, we can be more thorough because we're not competing against their fear during the exam. Just like in people, stress has a negative impact on our body. We can physically see those changes when pets are here and they're stressed out. So their blood pressure can increase. We can even see changes on their lab work. So those subtle changes we can actually monitor specifically. But the lower stress environment that they have, the better everything is for their treatment plans, for getting diagnostics done, and it's just better for their overall health and well-being.
What was the certification process like to become a Fear-Free Certified Veterinarian?
So the Fear-Free certification, when I first did it, this was during COVID, so it was primarily online, but it's a series of lectures where you specifically go into learning more about animal behavior, about kind of the signs of pets that are fearful, and those can start very subtly to the more extreme where you have a pet that's barking or lunging or biting, and majority of the time it's really just because they're afraid. So having an understanding of that, and a lot of it is really working with the owner to see, is there something that happened in the pet's past that's making them fearful? What do they respond well to? Some dogs are very food motivated, others prefer distractions or maybe a favorite toy. So really working with them to see what's going to be best for that pet, because for every pet it's very different, and that's really a lot of what the training is having those conversations and being able to make a plan for each individual pet.
And why is fear-free not common or practiced at all hospitals?
So what I often will say to owners is that a lot of the vets that I worked with growing up, and I grew up in a very small, very rural town, it was kind of like, whatever we need to get done, we're just gonna do it. So it doesn't matter if the pet is afraid, it doesn't matter if you have to hold them down on the table to get something done, we're just gonna do it. And now we know a lot more about their behavior and how intelligent animals are. They remember things. There's owners that swear by when they pull into this parking lot, their pet knows that they're here, and that is absolutely true. But the downside of doing the fear-free practices, although it is much more beneficial for the pets, is it is very time consuming. So having these conversations, making a plan, scheduling appointments appropriately to have enough time, even sometimes the time of day. So doing it first thing in the morning or last in the evening when there's less noise in the hospital, when we can use treats because the pet is hungry. These are all things that we kind of have to factor in when making these appointments. And it's a lot of staff that's required and a lot more time. And I think that's why not every hospital does it.
What are some other ways that we try to make our hospital low stress for pets?
So again, it really goes back to knowing that pet. So a lot of times even I'll have a pet come in, do a consult, and actually have them come back at a specific time of day, making sure that they're hungry, that they haven't had a meal, so we can use food as a motivator, having an owner bring their specific toy in that they like, and also being very cautious of the environment. So if a pet is kind of protective of the owner, sometimes we'll remove them from the owner and bring them into the back into one of our more open spaces where they don't feel like we're all kind of crowding in around them. Being cautious with if we're playing music in the back, lowering it if a pet is fearful, separating our cats and dogs, using things like pheromone sprays, treats. So there's, again, so many different things, and we really just try to tailor it to the individual needs of that patient. And one other thing that we do also offer is happy visits or fear-free visits. And essentially our goal in that is to reduce the negative experience that pets have coming into the hospital. So oftentimes they're coming in here either for a well visit, but they're getting vaccines, or a sick visit. So there's something wrong, they're not feeling well. The purpose of the happy visits is really to have them come in for something positive. So they're coming in, they're saying hi to staff, they're getting treats and love and attention, and they're going right back out to the owners without anything negative happening. The more often that we have the ability to do that, the more pleasant an experience it is for the pet, and the positive association is really our goal. Just like I don't love going to the dentist because every time I do, they're cleaning my teeth, it's uncomfortable. I'm not just going to the dentist to like hang out with them, but that's kind of our goal for the fear-free visits, is that our pets know that this is a positive place, and the more times that they can have that positive experience, it really just helps with their overall how they're perceiving coming into the vet.
Without further ado, I will introduce you to the Fear Free Mystery Box. Within this box contains the keys to the universe of Doggy Rizz. Dr. Cortright will put her arms through the patent-pending armholes and pull out the tools for success and explain why we use them.
I'm like very nervous. Okay, I really don't know what this is. This feels like a stuffy. Oh, it looks like a sprout, kind of. So toys, so this is always good. We can either use these as a distractor for patients, and we also do send home all of our surgery pets with a fun little gift after their surgery. Okay, oh God. Ah! What is that? Why does it feel sticky? Oh, it's peanut butter. I literally got really scared. Wait, how do I grab this? Is it just open? What is happening, Diana?
I'm not giving any hints.
Oh. Yep, treats. So this should be pretty self-explanatory, but whenever we're trying to do something, whether it's a vaccine, a nail trim, anything, giving one of our pets treats to distract them is usually a good distractor for them. You can even use this at home. One of my favorite things to do is put peanut butter on a lick mat, and that is a great way to distract your pet if you're giving him meds. You can also hide pills in a little bit of peanut butter too. I need a napkin. I'm gonna go on this side now. Be a little bit more cautious. What is this? Head tapping. I like it. So something that we do with our patients a lot is we'll say we need a head tapper, and what that literally means is someone coming over with their finger or a very small object and just tapping right here. It normally just causes the dog or cat to focus on that area and again distract them from whatever we're trying to do. That's really funny. Sprocket. She was very invested in this. Pets and cuddles Very sweet with the cactus.
For some of them, I just had to go with opposites.
I like it. So we do unfortunately have to use restraint in our pets majority of the time, but there's a way to do that in a very kind and comforting way. So as opposed to just holding them down, doing what we have to do, we try to almost make it seem like we're just giving them pets or cuddles, holding their head very comfortably. We want them to be as comfortable and the least amount of stress as possible. I love it. Yeah, so distracting noises. Same kind of idea as the head tapping. The more that you can distract them from what you're doing, the less that they really even realize what we're doing. So distracting noises are one of our go-tos always. So funny. Oh yes, so a separate quiet room. So this is a big one that we use, especially with fearful pets. Sometimes even in the exam room with their owner, it can just be too overwhelming being locked in. So some of the areas that we have in the back, they're wide open, they're nice and quiet, just to help reduce the stress of the pet. Calming spray, pheromones. So this is something that we use for almost all of our pets. For our cats specifically, we'll put a pheromone spray on a blanket or towel and bring that into the room. It just helps to promote a sense of calming and put them at ease during their appointment. What is this?
I don't know what it is.
Oh, going slow. So as we mentioned, fear-free visits do take a long time, and part of that is giving the pet time to warm up to you, to become calm, to get confident with the people that they're with. So you cannot rush this process. You have to take it as slow as possible to gain the pet's trust and make sure they're comfortable. If you rush into it, it almost never ends well for anyone.
Try the other hole. Try closer to the hole.
Drugs. What that means for our Fear Free is giving them some sort of anti-anxiety medication. So nothing that they need to be on long term, but just something to really help reduce their anxiety prior to coming in, whether that's a pet that's getting anxious for nail trims or vaccines, really just helps lower the threshold, and that way they have a more positive experience.
Finally, literally right after we filmed this, Dr. Cortright had this gorgeous patient named Nebula who was also very scared and anxious, and after having a really successful appointment here, her mom left this review. I kid you not, literally right after we filmed this video. Yay, you found it all!
Yay! Are you gonna edit these?
Yeah.
They weren't that bad, but the peanut butter really
Made you fearful?
really did.